second session of Hidden Treasures of Plant Kingdom. Our faculty for today's session is a renowned personality in the homeopathic fraternity. He is a mentor, an ideal, a guide, an idol for new and established homeopaths. He is former principal of Government Homeopathic Medical College of Bangalore and Chandigarh, director of VM Homeo Medical College, Salem, founder, president, and patron of Karnataka Qualified Homeopathic Doctors Association. He has been a resource person to many institutions, organizations, as well as published several articles in many homeopathic journals. I now request a multilinguistic, an orator, a Rotarian, and a disciplined practitioner of classical homeopathy, Professor Dr. B.D. Patel, sir, to start his session. Over to you, sir. Patel, sir.
Yeah.
Yes.
I'm here. Well, friends, good evening and Shubh Sandhya. Sayam Vanakkam. So now, in continuation to the title, Hidden Treasures of Plant, we'll go ahead and see. Allow me to make my presentation. Can I share my presentation?
Yes.
Yeah, okay. Right.
Yes, sir, it is visible.
Yeah. Some problem always with the technology. Is it visible?
Yes, sir.
Right. Now you see what happens generally, there's always a complaint. I have seen with many doctors, sir, my selection is perfect. Patient is calling for the same symptoms and same this thing, and I gave the same remedy. Somehow it is not acting, or if it is acting, it is only 50%, not 100% what we expect from the action of the medicine. Am I audible?
Yes, sir.
To everyone?
Yes, sir.
Yeah. So now this is, many of you might have also experienced, the symptoms are very same. The potency also may be little here and there, but once it suits the patient, once it covers the symptoms, the medicine must act. Why it doesn't act? And this happens mostly with the plant kingdom. Animal kingdom and chemicals are little better, but the big problem comes with the plant kingdom. The reason for that is this. It's found that many homeopathic medicines act only up to 60%, especially the plant medicine, though properly indicated. Can somebody read it? The best effects mentioned in the materia medica of a plant will only be possible if it is collected from the place where it has been proved first. This part I want you to make a note, is very, very important. See, suppose you say, let us say Tulsi. Tulsi of India is different from Tulsi of China. Tulsi of China is different from Tulsi of America. Tulsi of America is different from Tulsi of Japan. So suppose you prove Tulsi in India, and especially let us say in Kanpur, Neha Diwadi's village or city, that place itself you have to collect the Tulsi, and that only you have to prove. Otherwise, things will change, things will modify, and it will not be the same as the first prover who has done the proving. Dr. Neha, you ask somebody to read it, otherwise everybody will be sleeping.
Sir, I'll read, sir. The best effects mentioned in the Materia Medica of plant will be.
May I know who is speaking?
Dr. Trupti, sir.
Dr. Trupti, sir.
Trupti Pai should never read. She is super faculty. Trupti, super faculty should be, see, we are scared. Okay, anyway, somebody should read it. Yeah.
If it is collected from the place where it has been proved first, and also the way it was prepared and the parts that have been used, all these are very important.
Do you all agree on this point, what I'm mentioning? We ignore. And this is the basic fact why the medicines are effective in Germany and they're not effective in India. They're effective in America and not in India. This is the basic reason.
Many pharmacies use substitutes. Even then they work to some extent.
You should thank God. Many pharmacies use substitute for that, but still the medicine works for, let us say, 40 to 50%.
The specialty in plant kingdom is, in many cases, only certain portion of the plant is used to make medicines and not the whole plant, unless it is mentioned separately.
Now, do you know that? Let us take again the example of Tulsi. Tulsi leaf has a different property. Tulsi stalk has different property. Tulsi root has different property and Tulsi's flowers have different property. Tulsi seeds have different property. So whatever you are proving, that portion only has to be used to prepare the medicines and use them on the patients. Yeah.
The medicinal qualities of a plant may be obtained from various parts of it, and the qualities may vary with the part. Certain properties which reside in the roots, flowers, or seeds can be different or sometimes opposite. For instance, belladonna. One part of the plant gives us more of the acrid qualities of the drug, while another gives more of the narcotic properties.
Are you understanding, everyone? See, if the person uses the belladonna leaves, it gives different property. The root gives different property.
We must be careful while proving of a vegetable drug. Many of the medicinal properties of vegetable remedies owe their existence to substances derived from the minerals in the soil in which they grow.
This part also important. Why we should collect the medicine from where it has been brewed, first prepared and first brewed. This is the reason. The salts, the minerals in that soil will be different from the minerals in other places of the world.
The principal effects of some of the grasses are the results of the large quantity of silica they contain. Maximum effects of laurocerasus come from its hydrocyanic or prussic acid, which is commonly classed with the inorganic compounds.
Can anybody tell me where laurocerasus is used? At least one indication.
You can put it in the chat box.
Yeah. Before we go further, we'll let us just find discussion. A small tip. Laurocerasus is a chemical or a mineral or a plant? Anybody?
So cough, Dr. Ashita writes cough.
Okay. Anybody else cough? Then anywhere else?
So respiratory complaints.
Respiratory, anything more further?
Respiratory and cardiac symptoms, immunity,
Yes,
mind.
yes. Somebody's coming closer. Anybody, anything else?
Cardiac.
Cardiac,
mind.
Mind.
Hypoxia, chorea.
No, no. You are seeing Medica or what?
Dr. Binod has raised hand.
Yeah.
Dr. Binod Prasad.
Wait, I'll unmute.
Please unmute yourself. Dr. Vinayak, breathlessness.
See, cardiac, respiratory, and kidney. If the three organs are involved in a patient, this is the medicine straight away, give a few doses and it will take care of. Okay.
Now
Yeah.
these substances derived from the mineral kingdom and contained in the vegetable kingdom.
So the whatever plants, wherever they grow, they contain many things of the soil, and then the properties of that comes out.
Substances having the same origin generally do not follow each other well.
Do you agree on this? Now let us see a simple example.
For example, if you have given ignitia, it is not well to follow it with nux vomica and vice versa, because they both contain strychnia.
Dr. Tripti, your voice is modulating.
Okay, sir. We cannot confine ourselves strictly to the above rule regarding the sequence of drugs.
Don't you feel so, Dr. Neha?
Yes, sir, it's waving type.
Waving.
Dr. Anusha, can you read?
Yes.
Please, ma'am.
Take for instance the Ranunculaceae from which we obtain pulsatilla, aconite, helleborus, and stephysagria. There are no marked resemblances between them. The rule does not apply. Anacardium and rustox, these drugs bear a family resemblance, but their points of divergence are so great that one drug may act as an antidote to the other.
These are certain facts which we must remember when we are using plant kingdom, and also use them appropriately. Now you are seeing this. Can somebody read this? Bumps, bruises,
and breaks.
So now you see, it is all thing people is a player. Now you see how many injuries can happen at this. Each organ, ankle, lower leg, upper leg, hip, groin, knee, foot, hand, so many things. Okay.
Can we discuss some drugs which help us in accidents, falls, injuries, etc.?
We will give 1 minute, 1.5 minutes. All of you put down the names of the drugs in the chat box.
Please write down in the chat box.
What are the drugs which can be thought of in accidents?
So Dr. Shalini says arnica, calendula, arnica. Dr. Shripya, arnica, bellis.
A little louder voice.
So bellis,
Arnica, hypericum, calendula, ruta.
Very good.
Natrum sulph.
Okay, very good.
Symphytum.
Oh, what is it? Graphitum.
Symphytum.
Symphytum. Okay.
Yes. Echinacea. Somebody, thyroidinum.
Okay.
Bellus perennius, ledampal. Acid sulph.
stephysagria.
Eupatorium.
Yeah.
Calendula. Hepar sulph.
Okay.
Calcarea phos.
Very nice. Who mentioned hyper sulph?
Hepar sulph.
Huh? Somebody mentioned hyper sulph. No, who is that?
Yes, sir.
Anyhow, that's very nice. Why I'm particular about hyper sulph is it's also a drug for accident. But I mentioned here in the beginning that the medicines, as it was proved, from the place it was proved, from the part it was prepared, that should be used for better effects, whatever the prover has given in the Materia Medica. Now the same thing, I think our chairman sir remembers when I was teaching on that. See, hyper sulph is nothing but calcarea sulph. Just imagine calcarea sulph, what is its use, how much it is useful, and how much it is useful hyper sulph. Hyper sulph is prepared by Hahnemann from the shell between that calcium taken out and burnt in sulfur. Same chemical as calcareous sulfate is totally different when compared to Haber sulfate. Or action is very much limited of calcareous sulfite rather than Haber sulfate. That is because the Haber sulfate which Hahnemann proved had a lot of impurities in them. And those impurity qualities also have come up in the medicine. And it is one of the most indicated, most used polycrust remedy in our materia medica. Okay. And if you take up the Kent, he says, you give me one drug where I can practice, give me Haber sulfate, take away all drugs, still I can practice. Okay, that is important. So preparation, the way it is prepared and from where it is collected, it is important in plant medicines. Okay. All have you mentioned so many drugs. So let us take on some drugs. Yeah.
Traumatic affections to secure union by first intention and prevent suppuration. Calendula.
Calendula. This is one remedy which is very, very commonly, widely used all over maybe world as far as homeopathy is concerned. And even some allopathic doctors use. And we have also used it. And apart from giving in the tincture form, I have used more beneficially in potency, 30, 200, 1M. It will really work so well. Sometimes I'm surprised how these small pills do work that well. Many surgeons use that. Yeah.
Contraction of fingers after a sprain. Dislocation of patella on going upstairs. Cannabis sativa.
Can we think about this? See, sometimes suddenly the hand gets like this, spray, and you are not able to fold the fingers, contraction of fingers, that's it. And nothing happened, but just suddenly it got. You cannot bring them back normal. So the medicine is cannabis sativa. And some people have this problem. When they climb stairs, their knee becomes stiff and patella gets dislocated. Patella, you understand? Not Dr. Patel, it is patella. The covering of the knee, and the knee joint, you have a small bone. Everybody knows it. So this, if it gets dislocated when you're climbing, the same medicine, cannabis sativa, is useful.
Deep impression on finger from using blunt instruments. Scissors, knife.
Now, did you understand what I'm trying to tell you? How I remember this is, I'm talking of my Punjab days, when we were riding cycle and scooter, we used to do throttle and hold it, and this hand portion was getting thick skin. Now you might have seen some people who are tailors who cut the pant and all other material what they use. They use scissors, and the scissors holds here and here, and these two places the thick skin gets thinned up. No medicine anywhere in the world except homeopathy. And some people who are in the kitchen always, that is cooks, chefs, their hand, they hold the knife, and here it becomes very hard skin. For such skin, we have medicine called as Bovista. Bovista is a plant kingdom or animal kingdom? Anybody? Yes, friends?
You can write in the chat box.
Yes.
You can reply, sir.
Yes. Bovista is a plant or
Plant
an
kingdom.
Dr.
Dr. Shri
Sure.
says.
Right. Okay.
Bad effects from mountain climbing. Coca.
Now, did you understand this point? See, there are a lot of mountaineers, trekkers. This is a wonderful medicine for trekkers. And I was really surprised when somebody said, sir, today in Delhi or in Bangalore, we can use coca. Why? Because we stop stand at the bus stand, a long queue. You go to any office, there's a long queue. You go to ration office, there's a long queue. Standing there for when the hours and walking slowly can exhaust you, and can give the same complaint as if you are climbing a mountain. And the same medicine coca gives you relief instantaneously. Yeah.
Bruised feeling as if broken all over the body. Bone pains affecting back, head, chest, limbs, especially the wrists as if dislocated. Eupatorium perforatum.
See, everybody remembers the malaria-like symptoms, dengue-like symptoms, or epidural, but wrists as if dislocated. The wrist is more affected in epidural perforatum, and he says, "Sir, I can't move. The wrist, it has become so painful, and I feel it is dislocated." And this epidural perforatum is one of the great medicines. Yeah.
Injurious chronic effects from concussions of the brain and spine, especially spasms, trismus, spasm of jaw muscles, and tetanus from getting splinters into flesh. Cicuta.
We hardly think of this. Whenever we hear the word concussion, we only know one medicine. What is that? What is that? Anybody in the chat box? Concussion medicine.
Ruta. So Dr. Chetna says Ruta, Arnica. Arnica.
Yes, everybody talks about arnica, but very few people also know that cicuta virosa is there. I have used in many places, especially if there are epileptic attacks or fits started after head injury. One of the medicines or leading medicines are cicuta virosa. Arnica doesn't have that symptoms of fits, epilepsy, convulsions. Okay, it can be prescribed for anything after accident, yes, you can do. But when it goes to the extent of convulsions, cicuta has the capacity. And what is the position of cicuta? Head and the legs only touch the body. The entire body is up. Okay?
Somebody
The,
replied.
yeah. I will show you the photo also afterwards. Yeah.
Complaints caused by a blow or fall, glandular induration of stony hardness of mammae and testicles after bruises and injuries of glands. Conium.
Very few people prescribe conium for mammae or for any blow or fall. They hardly it is used as a, it is hardly it is used for injuries, but it is one of the very leading medicines, especially with the boys, where they come with the hydrocele, swollen testis, swollen this thing, varicose, all these things after an injury. Let us say, for example, they are driving cycle. So on the seat itself, it will hurt them. Or they're a sportsman, cricket, ball mara, usne wahan lag gaya, and finish. Like this, there are many cases, and conium should be thought of when the glands have become hard. If they are soft, you can think of arnica. But when they become hard, and hard glands hit, conium comes in the leading remedies.
Wounds, incised, lacerated, contused, injuries from falls, checks hemorrhages, removes pain and soreness. Hemamelis.
Hemamelis is only used for, many people have seen that they use it for bleeding and thereto from piles. Apart from that, it's a great medicine for bleeding anywhere. Only thing, you should have few symptoms of that. Incised wounds, lacerated wounds, contused wounds, injuries continuously bleeding, and darkish blood. Think of hemamelis.
Non-union of bones, symphytum.
It's called as bone union. Unifying the bones, you give symphytum. Yes, symphytum is the leading medicine, and the general way of prescription is prescribe symphytum whenever there is a fracture. You go for bandage, you go for plaster, all that. Give symphytum and follow with calcarea phos, lower potency like 6x or 30. Give Symphytum 10 mg. This is how we do. Give Symphytum 10 mg, follow with Calcarea first 30 or 6x. That will really take care of, heal faster. 6 weeks or 6 months, it will do it in 1 month, or maybe 3 weeks.
Mechanical injuries of spinal cord, bad effects of spinal concussion, pains after a fall on coccyx, punctured, incised or lacerated wounds, sore, painful, injuries from treading on nails, needles, pins, splinters, leadum from rat bites, prevents lockjaw, hypericum.
See, this is in our hospital, we used to generally prescribe for preventing tetanus, hypericum and Epitorium perfoliatum and some more medicines, ledampa like this, which really prevents tetanus forming. And every one of us know that whenever there is a sharp cut, needle pricking, where the pain goes just entire in the course of the nerve, hypericum is one which will take care of it. And all the bites, we think of two medicines basically. One is ledampal, another is hypericum. The only difference between ledampal and hypericum is ledampal, the pain or the swelling, whatever it is, stays around that place. But here hypericum, it radiates upwards. Okay, this is one. It can be punctured, and there's the reason why any operation happens. People give hypericum, staph agria, something like that. Now, this an important part here I want you to pay attention is, whenever you are climbing stairs, suddenly you fall down and you hit your back, especially the coccyx. This is one medicine. Whatever medicine you give a few doses of this, then follow with whatever indicated medicines. It's so much, affinity is so much to the coccyx and the back, and sudden falling and thump, just like thump, you sit down on the staircase or anywhere. Earlier, there were some people used to play games. When somebody looks that side, they used to pull down the chair, and that fellow has, while sitting, he will fall down. The medicine is hypericum.
Nervous depression following wounds or surgical operations removes bad effects of shock, of fright, of mesmerism, hypericum.
Now, nervous depression. Depression happens sometimes after a major operation or an accident. There are few medicines. One is arnica, hypericum, and staph agria, which will take care. Just see few symptoms and prescribe them. The person will come out, and you need not go for anti-depression drugs. Now, the one word I have given, I don't know how many people have paid attention. Mesmerism. You know, people have mesmerized, sir. I am highly influenced by that person. I don't know what to do. I cannot come out of my feelings for them. That is mesmerism or hypnotism, whatever you call that. So for that also, you have medicines in homeopathy called as hypericum. It will remove the bad effects of a shock after fright. There are other medicines which will come in due course.
Tetanus after traumatic injuries, hypericum.
Yeah. As I told you earlier, tetanus is there.
Ailments from overlifting, overexertion, or a fall, hemoptysis after injury, mellifolium.
Mellifolium, I don't know how many of you have used it any time. Ailment from overlifting. For overlifting, what are the drugs we use? Anybody? Tuck, tuck, tuck. What are the drugs we use for ailments,
Ruta.
complaints after overlifting?
Ganga Mruta says Ruta, Calcarea, Cav, Rustox, Bellisper.
Bellisper, then?
Rustox.
Yeah. Rustox, all that. Then one more medicine you have forgotten, very common, which follows Rustox very well.
Symphytum.
Symphytum, then it is causticum. Okay, it is not from vegetable kingdom. Fine. Now this mellifolium.
Bryonia also.
Yeah, Brian. Mellifolium, I just want to mention now, I remembered one case I presented in Rajamandri, Andhra, where there were lot of vaginal warts for a child of 8 years, 9 years. So many medicines were given, didn't work. We prescribed melifolium, and depending upon there was a blood coming out of the vagina for the small child. So we prescribed that, and believe me, miraculously all the warts vanished. I presented that case in Andhra. I came back to Bangalore. I was presenting some other program in a college. My hard disk got burnt and I'm not able to retrieve that case. It was a wonderful case. Melifolium curing warts in a girl, vaginal warts. Anyhow, that's just for information. Yeah.
Chronic effects of mechanical injuries, menses flow disturbed after a blow to ovary from jolting while riding over rough roads, hemamelis.
You have seen now there is one advertisement, move advertisement. The lady takes her child on a rough roads on the scooter and it keeps on jumping. For such injuries, for such effects of such riding, we have hemamelis. We think of arnica, but think of also hemamelis. Chronic effects of mechanical injuries. If arnica, the patient is not responding, or ruta not responding, think of hemamelis. We should be always able to prepare to think out of the box. And you see a very wonderful here mentioned, flow, menses disturbed after injury to ovary, a blow to ovary. For somewhere the lady is playing kabaddi, maybe it was there, or she's lifting something and suddenly she hits something and it hits her ovary and the menses are disturbed. You may give any medicine according to symptomatology. If it doesn't work, just think of hemamelis.
Bad effects from falls, contusions, or mechanical injuries of external parts, euphrasia.
This all you understand? Bad effects of falls, contusion, mechanical injuries of external parts, anywhere in the body. And also a blow to eye, especially the boxers and all that, they hit, some native hits the eye. This is the medicine euphrasia.
From spraining or straining a single part, muscle or tendon, overlifting, particularly from stretching high up to reach things, rustox.
You have seen that in the films they show, when the lady is trying to take out something from the kitchen. Kamar pakad gaya. That's what they apply move, and you have to daily apply move. But when we prescribe few doses of rustox, the effect will go permanently and follow it with a little bit of causticum.
Scrofulous exostosis, bruises, and other mechanical injuries of bones and periosteum, sprains, periostitis, erysipelas, fractures, and especially dislocations, rustox.
So fractures also you can give rustox and keep quiet. You need not go for plastering. Is it right? Am I right? No. If it is a fracture, you must go to an orthopedist, get it united, get it plastered, then prescribe these medicines. Sometimes after the accident, everything is over. Periosteum, I hope all of you know periosteum. The pain is not in the bone deep, but on the periosteum. Again, rustox is one which helps. Mechanical injuries with arnica, rustox. Some other class, if we take up, we will try to differentiate between all these remedies. But here now, I'm just giving information where the plants can be used for the various injuries. And exostosis. You know where sometimes where there's injury, the bone grows extra there. The other medicine is Calcarea fos. Arnica also sometimes, but rustox can also be prescribed. Yeah.
Bruised lame sensation all over, as after a fall or blow, worse in limbs and joints. All parts of the body upon which he lies are painful, as if bruised, rustox.
Rustox. All, see, the rustox is very close to arnica. In many of the symptoms are very close. Now you see here, Worse in limbs and joints says all parts of the body upon which he lies are painful, as if bruised. The same symptom in arnica is how much ever soft the bed is, he feels the bed is very hard. He wants a softer and softer. He keeps on changing the sides. He keeps on changing the sides, arnica, for finding a softer place. But this restox, it is a tendency that he can't lie down still. If he lies down the still, the part becomes more painful. So he keeps on moving. Now we will take 3 minutes break. Our super faculty, Dr. Trupti Pai, has to make some announcements. Over to you, Dr. Trupti Pai.
Yes, sir. Sir, I'll just stop the screen sharing.
Right, I'll stop it. Yeah.
Thank you, sir. Good evening, everyone. I, Dr. Trupti Pai, coordinator at NICE, would like to run through clinical excellence course offered by our institute. The finishing course is a post-graduation diploma course in advanced classical homeopathy, DACH, also known as metamorphosis, customized to help practitioners to overcome the hurdles or challenges faced in the clinical practice. The course is designed in such a way covering different finer aspects, right from consultation to prescribing the similimum. The analysis of the case, understanding the patient with use of evidence-based tools, handling acute cases, repetition, wait and watch cases, utility of myasins, potency selection, which puts most of the physicians in a dilemma as to when to increase or decrease the potency or change the remedy. All these aspects are covered in this course. These sessions aim at classical practice as per Hahnemannian teachings, as well as teachings of Dr. Kent, Boninghosen, Boger. Our faculties, with their golden years of experience, share the clinical tips and differential materia medica in these sessions. They also guide our participants with their cases, even after the course is over. This course is a boon for doctors who have taken break from practice, want to upgrade their skills, and strengthen their clinicals. We have, to date, successfully completed 7 batches, and our next batch will start soon. Kindly contact any of our coordinators to know more about the course and details. The details of our coordinators will be shared at the end of the session. Thank you for patience hearing. Over to you, sir. Thank you.
Sir, you can continue, sir.
Yeah. Is it visible?
Yes, sir.
Yeah.
Mechanical injuries from sharp cutting instruments, post-surgical operations, stinging, smarting pains like the cutting of a knife, staphysagria.
That's what we were just discussing. Anything after surgical operations, I think this is what Dr. Swami has seen in many of our cases. I prescribe staphysagria. Just he says I had a cesarean operation, or she will say something, some uterus is removed, and so many symptoms come out of that. A few doses of staphysagria, wait, if the things get cleared up, other symptoms come, and prescribe the medicines.
Facilitates union of fractured bone, lessens peculiar pricking pain, favors production of callus, pain in eye after a blow, symphytum.
This is what we do. Symphytum is pain in eye after a blow. I was telling you on euphrasia and also this. And symphytum has more affinity for blow than euphrasia. And it really, really helps in callus formation, in the healing of the bone or a fractured portion. So just remember symphytum.
Venous congestion due to mechanical causes, first remedy in injuries to the deeper tissues after major surgical work. Excellent remedy for sprains and bruises. Bellis parens.
Yeah, bellis parens is very less used as compared to its efficacy. Please use it. Now it's venous congestion, not active like belladonna, arnica, fast bleeding. But here it is venous congestion. And there is a condition called as DVT, deep vein thrombosis. It may not be an injury, but if it happens, Bellis perennis, don't forget to prescribe few doses, and slowly in a month or so, the clot will dissolve. Those who are having this problem can try few doses. You can use even mother tinctures also. Sprains, an excellent remedy as usual for sprains and injuries of deeper tissues, because deeper veins, in that the blood gets clotted.
Conium maculatum umbelliferae, below upwards, the lower part of the body, giving out before the upper.
We discussed conium earlier, and the effects of the conium will be not only injuries, other complaints also. The upper, more than upper part, the lower part first gets the problem and then it travels up.
Cicuta virosa, the umbelliferae, when taken in any quantity, produces congestion at the base of the brain and in the medulla oblongata.
That's where you start epilepsy, conversions, fits, and all that. So cicuta has that affinity for the base of the brain.
Anacardiaceae, injury to tendons.
Can you believe anacardium hardly we prescribe in injuries? But that is, its affinity is for injuries to tendons, muscle tendons, at the end of the muscle, and the where it is attached to bone, it is the tendon that gets pain, that gets dislocated, that has problem, all those things.
Injury or pain in periosteum ruta.
Yes, this we must remember by heart.
Tetanus preventive after injury, hypericum and physiostigma.
Hardly people use physiostigma or this remedy for injuries. So let us remember there are other cicuta also, there are other medicines. Apart from that, these two are very prominently indicated.
Injury to breast, phytolacca.
Yes, the leading remedy is phytolacca. Conium also works, many other medicines work, but phytolacca is the leading remedy.
Injury to ankles with edema, arnica, ledum, and bryonia.
I presented this somewhere, they mixed all the three drugs and gave. Don't do that. Arnica, ledum, bryonia. Take few symptoms. Take the color. If it is blue, black, arnica. If the pain is just around that, it is Nadampal. If the pain is more while moving, it is Bryonia. Simple things.
Injury to elbow, Bellus perennis.
It doesn't make it very safe and simpler and very particular. When your elbow gets hurt, you are just sitting on the table, you hit it like this and it changes and you get injured, then few doses of Bellus perennis.
Injury to abdomen, calendula.
Can you believe this? This is what when you do boxing player, they sometimes hit in the abdomen, or ladies working in the kitchen suddenly hit something to abdomen and calendarize the medicine. Then may not be any bleeding, but inside effects are removed.
Mental symptoms after injury, cicuta and hypericum.
Don't forget that.
Composite, a very large order from which we obtain a number of drugs. Namely arnica, chamomilla, senna, eupatorium perfoliatum, eupatorium purpureum, Artemisia vulgaris, Artemisia arbotenum, Artemisia tridentata, Absinthium, Millifolium, Taraxacum, and Calendula.
See, this is one compositive family where the medicines are also very popular and more, and in that more medicines are towards the injuries, pains, and hitting the what you call the structures where pain is more experienced.
The name is derived from arcanus, meaning lambskin, because of the woolly appearance of its leaf. Montana, from the Latin montanus, meaning mountainous, because of its area of growth.
What is this? Anybody?
Please reply in the chat box.
Yes.
Calendula, sir.
Calendula. Very good. Anybody else?
Or are like writing the same.
Yeah. Huh?
Calendula, sir. Chamomilla. Someone wrote chamomilla. Arnica.
It is arnica. This is arnica. That will take care of.
Dr. Jyoti says arnica.
Yes, arnica. She's right. Arnica, who said arnica is right. And if we have the time, we will take up this drug. Otherwise, I'll give you a few indications of the medicines prepared from plant and clear-cut indications. Clean tongue. Somebody can read it?
Clean
Yes, sir.
tongue, Ipecac cancina. Chelidonium, tongue yellow with imprint of teeth, large, flabby.
See, you see the plant. Here it is yellow. Okay? At the root it is yellow. Here it is yellow but fine, but it is more swollen, more flabby.
Baptisia, brownish coating of tongue, homeopathy learning system.
Yeah.
Strawberry tongue, belladonna, aurum trif. Naxomica, first half is clean, posterior is coated with deep fur, white, yellow, cracked edges. Ranunculus bulbosa.
Can you believe this?
Peeling off the skin of the tongue.
Can you believe this? Have you seen any time? I am yet to see such a case in my 50 years of practice. But if it comes, it's a horrible thing. The patient cannot, the suffering is more of the pain rather than the disease. And the medicine we have, if you know, and if you remember at that time, we can save the life, we can save the patient from the agony.
Rustox, tip has triangular redness and cracked. Thuja, a cyst under the tongue, white, painful blisters close to the root of the tongue.
Dr. Swami was telling the last class, Thuja has ranula, okay? The cyst, this is what exactly it is. Okay.
Arnica montana grows in nutrient-poor siliceous meadows or clay soils. It is also called fall crot, fall plant, meaning the herb useful after a fall. Nevertheless, it is cultivated on a large scale in Estonia. It mostly grows on alpine meadows and up to nearly 3,000 meters, 9,800 feet. In more upland regions, it may also be found on nutrient-poor, uncultivated land with sandy soil and scrubby vegetation. Arnica does not grow on lime soil. It is an extremely reliable bioindicator for nutrient-poor and acidic soils.
This is an important factor because many of the Indian soil has lime in that. It hardly grows in India.
A widely spread plant growing on the high mountain plains of Germany, Russia to Siberia. Arnica montana is a remedy much older than homeopathy and was used much before Hahnemann's time. In 16th century, Professor Joel in Göttingen was the first to recognize the importance of arnica as a healing herb. Dr. Hahnemann, first provings of Hahnemann was made with the arnica root, one of the most wonderful results of his exploration, and all from the root.
Now, are you understanding the importance of the part? If you use leaves, it will be totally opposite, but only the roots can help.
The tincture of the drug should be prepared from the roots of the plant rather than from the flowers. because the latter are frequently infested by little insects, the bodies of which, together with the eggs, considerably modify the action of the pure drug and, of course, add symptoms.
And it can be very poisonous.
The flowers with infestation become poisonous. The cattle never touch it. The root of this plant, whose favorite habitat is in shrub-grown upland plains, very soon loses in the air a considerable portion of its odor and of its medicinal power, but it loses most by boiling.
So the leaves, the root, if you boil it and all that, it will lose its properties.
The freshly prepared powder, dried rapidly and thoroughly in the water bath, may be kept with almost unimpaired power for several years in well-corked phials.
You are getting this point? This is how it is.
While there have been a few cases of death resulting from its extravagant use, most of them have been traced to preparations in which the flowers were used, so that it is not unlikely that the fatal result was due to the insects. We also find an essential oil in the flowers differing from that found in the roots.
Are you getting the importance of the part which is used only should be used for preparing medicines also?
The species which is official in our Materia Medica, the Arnica montana, does not grow in USA, but is indigenous to Europe.
Is it clear to you?
Arnica may be used as a preventive of pyemia. It is thought by some physicians.
Pyemia means septicemia, okay, where there's pus formation. Yeah.
It is thought by some physicians that arnica promotes the evacuation of pus and promotes the appearance of pus on the surface of a sore with the object of preventing pyemia.
Deep inside, okay, right.
Routine practice among physicians of giving this drug to women after delivery.
Yeah, many people have this habit. Few doses of arnica you give it after delivery, things would be all right. The healing and the uterus contracting will be normal.
Produces conditions upon the system quite similar to those resulting from injuries, falls, blows, contusions, tinnitus aureum.
Tinnitus means, sounds in the ear.
Putrid phenomena, septic conditions, prophylactic of pus infection, apoplexy, red, full face.
See, putrid phenomena, septic conditions can lead to many things. Pus formation, fades, full face, face becomes red, and all those things. All these things can be prevented with few doses of arnica.
Effects of mechanical injuries years ago.
Even if you say, sir, मुझे बचपन में मार लगा है, you can prescribe few doses. No, sir, just I got hurt, but that has nothing to do with my present condition. But this is sure that it was not there before my getting hurt. Now I have the complaint. Give few doses of arnica.
Injuries from blunt instruments.
Yes, we all know that, very famous.
It is especially suited to cases when any injury, however remote, seems to have caused the present trouble. After traumatic injuries, overuse of any organ strains, arnica is disposed to cerebral congestion.
Anyway, I told you, we have heard of cicuta also. Cicuta, this is general cerebral congestion that has a particular affinity for medulla oblongata.
Acts best in plethoric, feebly debilitated with impoverished blood, cardiac dropsy with dyspnea, a muscular tonic. Limbs and body ache as if beaten, joints as if sprained, bed feels too hard.
Yes. It has a very strong action on heart. Let us remember that, arnica.
Traumatism of grief, remorse, or sudden realization of financial loss.
We always think of natriumur and other things. Arnica is also a medicine for symptoms coming out of shock, disappointment, financial loss.
Marked effect on the blood, affects the venous system, inducing stasis, ecchymosis, and hemorrhages. Relaxed blood vessels, black and blue spots. Sore, lame, bruised feeling. Tendency to hemorrhage and low fever states.
Low fever states means you understand, especially fever like typhoid. Okay.
Neuralgias originating in disturbances of pneumogastric. Rheumatism of muscular and tendinous tissue, especially of back and shoulders.
So we all remember that. Most of us know, even without remember anything. Arnica means injury to back and shoulders, rheumatic pains, all those things.
Tendency to tissue degeneration, septic conditions, abscess that do not mature.
Yes.
Aversion to tobacco, influenza, thrombosis, hematocele.
Aversion to tobacco is very important. And complaints after influenza, thrombosis, hematocele, all this.
Mind, fears touch or the approach of anyone.
Yes, this is one. The patient has a lot of fear. He doesn't even allow the doctor to come near and examine him.
Unconscious when spoken to answers correctly, but relapses.
Back to unconsciousness. This is a typical symptom of arnica, and especially in low fevers, what they call low fevers. One of the examples is typhoid.
Indifference, inability to perform continuous active work, morose, delirious. Nervous, cannot bear pain, whole body oversensitive. Says there is nothing the matter with him.
Yeah, even he is very, this is a common symptom which most of us remember. He's severely suffering, but he says, no, I'm all right. Why doctor is sent? I have no problem.
Wants to be let alone, agoraphobia, fear of space.
Wants to be alone.
After mental strain or shock.
See, we always think, we never think, it doesn't strike our mind, arnica also can work like this. We think only of natrimur or sepia or aromaticum, arginate, something like that. Not this. Okay.
Scalp feels contracted, cold spot on forehead.
Yes. This is one. Another remedy is calcare, where you have cold spots anywhere in the body. So another one remedy with us is arnica.
Chronic vertigo, objects whirl about, especially when walking.
Yes. Vertigo, when he is walking, he feels the world is moving around.
Eyes, diplopia from traumatism, muscular paralysis, retinal hemorrhage, bruised, sore feeling in eyes after close work. Must keep eyes open, dizzy on closing them. Feels tired and weary after sightseeing, moving pictures, etc. Blood from ears. Dullness of hearing after concussion, pain in cartilages of ears as if bruised.
Loss of hearing after injury.
Bleeding after every fit of coughing.
Yes.
Mouth, fetid breath, dry and thirsty. Bitter taste, taste as from bad eggs. Soreness of gums after teeth extraction, empyema of maxillary sinus.
Let us remember two remedies, especially complaints after toothache or tooth extraction, or what do you call that, treatment of gums, treatment of what do you call that, yeah.
5 years.
No, they do know what they do.
Root canal.
Root canal. Yeah, बुढ़ा हो गया. Root canal treatment. People develop migraines after that. People develop headaches. People develop irritation. All these things can be tackled with 2-3 medicines. What we have: arnica, hypericum, symphytum, and diputorium. Just think of all these 3-4 remedies. In that only it covers, and you can take the patient out of the problem.
He is full of dreadful anguish, but finally he comes to himself, lies down and goes off into a sleep of terror, jumps up again with a fear of sudden death and says, "Send for a doctor at once."
And after a doctor comes in, why did you send for a doctor? I am fine, there is no problem. This is Arnika state.
It is also seen in persons who have gone through a railroad accident
Yes.
or through some shock, who are sore and bruised from injury.
Yes.
This is similar to opium, only the opium fear remains, even in the daytime. Arnika dreams of it. Horror of instant death with cardiac distress in night.
Yes. Can you tell me what are the other medicines where you have fear of death with the cardiac problems? Fatafat, anybody in the chat box?
Arsenic album,
Yes.
aconite,
Aconite, very good.
calcareous,
Anybody else?
delphinium, digitalis,
Cactus is also
amphora.
there. Cactus is also there. Okay, very good. Good. Yeah.
Stomach longing for vinegar.
Vinegar, everybody understand sirka, what we call in northern part of India.
Distaste for milk and meat, canine hunger. Pain in stomach during eating. Repletion with loathing.
Recently, we got a case of a small child of 5 years, Sheikh Hussein, something like that. Sheikh Yusuf, their boy 5 years, he has mediastinal lymphadenitis, and the symptom was whenever he is eating, there is a pain. We gave him 15 days medicine. He came after taking treatment from all others, including allopathy and all that. Within 15 days, the few doses of medicine what we prescribed, the pain has vanished completely. Yesterday they had come. The medicine was not arnica, but it was tuberculinum.
Oppressive gases pass upward and downward. Fitted vomiting, vomiting of blood. Stool, straining of tenesmus and diarrhea. Offensive, brown, bloody, putrid, involuntary. Must lie down after every stool.
Yes, this is one. As we find in phosphoric acid, total tiredness, exhaustive. This is also there. He must lie down after every time he passes motion.
Diarrhea of consumption, worse lying on left side.
How many of you really understand the meaning of consumption? Let them put in the chat box. Anybody?
Tuberculinum.
No, it is
Tuberculosis.
Consumption is a old word for
Alcohol.
tuberculosis. We should know that. It's an old language, old English.
Urinary retained from overexertion.
Yes, this is we think of generally causticum, but this is also one remedy where overexertion, the urine doesn't come out.
Female, bruised parts after labor, violent after pains.
Yes.
Uterine hemorrhage from mechanical injury after coition.
Especially this, very few ladies come and tell you. And once they come and tell you, you must be able to prescribe arnica.
Sore nipples, mastitis from injury. Feeling as if fetus were lying crosswise.
Crosswise. This is a psychotic symptom. The child may be normal, but she has a feeling.
Respiratory hoarseness from overuse of voice. Raw, sore feeling in morning, cough produced by weeping and lamenting. Dry from tickling low down in trachea. Violent spasmodic cough with facial herpes. Heart, angina pectoris, pain especially severe in elbow of left arm.
This is the symptom indications. See, we have cactus, we have so many other medicines. But small thing, pain severe in elbow of the left arm. That will make it different from the other medicines. Cactus is a typical expression of a angina.
Fatty heart and hypertrophy, extremities gout, great fear of being touched or approached.
Sure. Please don't come near. Please don't come near me, because he's scared. If somebody one touches, it becomes more. That's an indicating symptom. Whether other symptoms are there with the arnica or not, no problem. But if he has the typical fear, no, mere paas mein batao, don't come near me. Nanballi hatra barbeda. This is the symptom of arnica. Not
Pain
only
in
this
back.
joints, but even in fever, in any other condition. If the patient, please, sir, please don't come near me. I'm scared. Yeah.
Pain in back and limbs as if bruised or beaten, sprained and dislocated feeling, soreness after overexertion. Everything on which he lies seems too hard.
Yeah, this is what I told you.
Deathly coldness of forearm. Rheumatism begins low down and works up, ledum. Skin black and blue, itching, small pimples, crops of small boils.
This
Sleepless.
these crops of small boils, as typically mentioned, it is in what you call pimples and acne, and they are very, very painful just for touch. Without touching, if they are painful, hape yourself. If you touch and it is very painful, then arnica. Yeah.
Sleepless and restless when overtired, dreams of death, mutilated bodies, anxious and terrible.
Yes, his dreams we must consider, they're tremendous.
Involuntary stools during sleep.
Yes.
Fever, febrile symptoms closely related to typhoid, shivering over whole body, heat and redness of head with coolness of rest of body. Locally the tincture, but should never be applied hot or at all when abrasions or cuts are present.
This point I want to stress on. People use arnica mother tinctures also. Fine, use it. It can be applied on the skin. But if the skin is cut, don't apply. Use calendula, because it has a lot of other effects and it can be negative, and you can have more problems.
Antidotes, camphor, ribbon-like stools from enlarged prostate or retroverted uterus.
This is one symptom we should take care of, and we very less we remember, and very less we ask the patient also, do you have a ribbon-like stool? Who will see? Who will see? But if the patient is particular and he says, sir, I'm having very thin type of stool like a ribbon, but I have this problem of prostate or my uterus is retroverted, think of arnica.
Aggravation at rest when lying down from wine. Several studies have been conducted in order to monitor the effects of arnica on muscles with a minor injury. These studies have provided evidence that the active ingredient provides up to 30% relief in inflammation and can also assist with relieving pain and muscle stiffness.
So 5 more minutes are left.
Okay, Dr. Super faculty, I wanted to stop, but anyhow, she's reading. Okay, continue.
When it is undiluted, arnica may cause side effects like nausea,
This is
rapid
what I
heart
wanted
rate,
to show. Yeah.
and bruising or bleeding. It may also interact with blood thinning drugs.
Never use arnica if your patient is on anti-thinning drugs like what do you call this painkiller, what is that? Aspirin. Aspirin drug. Don't give arnica, because if it really works, it can work against that drug.
Side effects, cardiac arrest, fast heartbeat, shortness of breath, stomach pain, diarrhea, vomiting. Pure arnica is considered an unsafe herb by the FDA. Arnica is widely used in homeopathic medicine to promote hair growth, prevent hair loss, and treat dandruff. In theory, applying arnica oil may help reduce scalp irritation and inflammation due to its anti-inflammatory properties, which may allow for a better environment for hair growth.
Yeah. Okay, this is my last slide. And why I have put this slide is equal to arnica, we have one more medicine called as cantharis. How many of you know cantharis? Cantharis is not from herb, fine, it's a Spanish fly. If anybody wants to remember maximum symptoms of cantharis, please go and see this film. It's an old film, maybe comedy. Take only symptoms of cantharis. Everything is explained in that without telling it's a homeopathic materia medica, but the symptoms can be easily remembered because I have seen this film when we were very young, maybe in the college or in Chandigarh. Please see this film. It's available on the YouTube. Thank you, friends. Now, this is what we call Cicuta virosa. This is how the patient's fits will be. So thank you very much. And we have taken more time, Dr. Nehaji,
Yes,
to
sir.
excuse us 10
Thank you,
minutes
sir.
more.
Thank you very much, sir, for a wonderful insight in the plant kingdom. As we are celebrating the 10th year of our institute,
Yes.
we request all our participants to stay connected with us through our WhatsApp group. If any one of you is still not in the group, kindly contact any of our coordinators and join WhatsApp group. And if somebody has missed our last session, which was held on 26th July, you can just visit our website, which is visible. Website link is visible on your screens, and you can take the screenshots. And please invite your homeopathic friends for the upcoming sessions, which is on 9th August, same Wednesday, 8:30 to 9:30. And we hope you all will give your feedbacks to the WhatsApp group. We'll open you for the next 24 to 48 hours, hoping that our next session will be a great blast with you all. And thank you, sir. Thank you, Dr. Shripad Hegde, sir, for joining the session and taking out the time, your precious time. And thank you, Patel, sir. And Shubh Ratri to all. Hope you all will join our next session.
Do one thing, anybody wants anything, they can put in the chat, what do you call, on the WhatsApp group.
WhatsApp group.
Any more questions or anything they want to say, convey to me, they can put it there.
Yes, sir. We'll open the WhatsApp group for
Yeah.
24 hours. They can ask there.
Yeah.
Thank you, sir.